We've given ample warnings and cautions. That time has gone. Thank you.
Premier, it's now day 50 of the lockdown. A record number of cases today, 466. Why has it taken you 7 weeks to further strengthen the current restrictions?
It's apparent that when you are dealing with the Delta variant, as we've seen in other parts of the world, you need to take the best advice but also be flexible as the pandemic moves forward. And it's really important for us that when we see a new front, that when we see action that we need to take, we take it immediately and decisively, and that's exactly what we do. It's also important for us to explain every step along the way to the community. And again, I want to thank the vast majority of our community is doing the right thing. And every day I feel the burden intensely of what we're asking our citizens to do. What we're asking our citizens to do has been the most difficult decision of my life and the most difficult decision our government hopefully will ever have to make. But it's to keep our community safe. But I appreciate our community also understands the changing nature of the Delta strain and our ability to move with it, to get in front of it. And the case numbers overnight are very concerning, extremely concerning. We cannot see this trend to continue. And whilst the vast majority of people are doing the right thing, too many people, a handful of people aren't, and that will have devastating consequences because the Delta variant leaves no room for error. If you look overseas, even in communities with high rates of vaccination, they have thousands and thousands of cases every single day. And that's why, for a long time, we've been urging our citizens to come forward and get vaccinated. Vaccination is our key to getting us out of this difficult situation. No doubt you need the lockdowns. I don't resolve from that for a second. But the vaccination, getting our vaccination rates up, will keep people out of hospital, because the important number for us to remember is the number of lives we save, the number of people we keep out of hospital. So I urge everybody, if you have a loved one that isn't yet vaccinated, especially if they're vulnerable, especially if they're active because they have to leave home to work, please make sure you urge them to get vaccinated. I can't say that strongly enough. And I wish we weren't in this situation. I wish things were getting better. But this is the nature of the Delta variant. And I think for some time we thought Australia was different to other parts of the world, but we're not. And we have to deal with it as best we can, and I know we will. I have absolute faith in our citizens, as I've had from day one. I have faith in all the people that are working together in government with community, even with non-government organisations, to get support to people who need it the most. We will get through this, but September and October are going to be very difficult. At the end of October, we'll have 70% double doses of the vaccine. By mid-November, we'll have 2 doses of 80% of the vaccine to adults. And until that time, September and October will be difficult, as I've said. And the challenge for us is to see how freely and safely our communities can live during September and October. And the key to this, however, is not seeing the case numbers escalate but come down. And a key way to help us do that is the vaccine. But I do want to stress to people, just because you've had your jab, don't feel confident. It takes 3 weeks for the effects of the dose to work in your body. As Dr. McAnulty will say and Dr. Chant will say, it takes 3 weeks for the dose to actually work once you've had it. So don't think that you're immune, you're not going to get it. Quite the opposite. You will still be exposed for at least 3 weeks, and even after then, you still have to act as though you've got the virus or others do. Because when you have a proportion of the community that's not vaccinated, they're extremely exposed, and that's why we're very worried about our Indigenous communities in Western New South Wales. And that's why we asked the federal government to get us Pfizer doses into those communities, and I'm grateful that they did that in the last 48 hours, and I thank them for that. But it's really, really important for us to acknowledge and accept that we need vaccination as a key tool in fighting this. This is literally a war, and we've known we've been in a war for some time, but never to this extent. And I know that we will get through these difficult times. We always do. And I never, ever, ever give up hope that our citizens will enjoy those freedoms we did before the outbreak as soon as we can.
You know you've been in a war for some time then. Why has it taken 7 weeks to get to this point?
I say to the people of this state, we've brought the community along with us every step of the way. We've accepted the best advice, and we've kept people out of hospital, and kept people alive and made sure we did our bit in getting as many jabs in arms as possible. Can I say what a great deal of pleasure it gave me to learn last night that in those 2 local government areas of particular concern right at the beginning of the outbreak in Fairfield and Canterbury-Bankstown, we had very low rates of first dose vaccinations. Now we're over 40% in each of those areas. Now that will help us, and those areas significantly have also seen a stabilisation or reduction in cases, and that's because we know now what it takes to have that consistent, targeted approach, local government area by local government area, to make sure that we are dealing with each community according to their needs. Whilst we are one New South Wales and one nation, we know that different parts of our state have different needs, and we have to respond to those accordingly. And I appreciate the patience that people have exercised. I appreciate the frustration, and I also want to let business and individuals know the disaster payments, obviously, you go through Service Australia and that kicks in every single week. You don't need to reapply. And with businesses, I want to give the community an update that the wait times now for getting your application sorted is down to 10 minutes, and you'll have the money in your account within 4 or 5 days. So please know we're doing everything we can to reduce your stress, but we're also asking you more than ever before to protect yourself and your loved ones. These high rates of cases day on day in the past week have demonstrated now that the virus is circulating in higher numbers than we've ever seen in Australia. And we need to make sure that we have as many people vaccinated as possible, because the statistics and the facts are higher rates of vaccination are saving lives, keeping people out of hospital, and at the end of the day, that is the statistics that matters the most. How many lives we save and how many people we keep out of hospital. And that is critical. And we know the vaccination is key to that. There are always in hours of darkness, as we face now, there are always silver linings. And one silver lining is that all the vaccines offered to us in Australia are fighting against the Delta strain very, very well. The vaccine is our major weapon against Delta. We are winning the war when it comes to vaccines and Delta. People who are vaccinated are staying out of hospital, are staying safer and healthier. But of course, if you're vulnerable with pre-existing conditions, you're always going to be more susceptible. And that's why it's really important to make sure those vulnerable in our community, those that are active, we're seeing younger people impacted more than before, and we're doing our best to get those jabs in arms. We're stepping up. Even though the New South Wales government didn't have the responsibility to do this, we've stepped up. We've made sure we've made it our responsibility to keep our citizens alive and as safe as possible. And I just want to thank everybody for responding.
For months now, we've been told that transmission is mostly occurring indoors at homes and businesses. Why are you now cracking down on outdoor recreation? Is there now evidence of outdoor transmission? And if not, why are you doing this?
Look, that was a request that came from police in relation to operational matters. We don't want to see any risk of the virus spreading in any way. And whilst there's no strong evidence about outdoor transmission, in fact, we've not seen very many cases at all, what the health experts and the police both want is to see less mobility, less people moving around, and anything we can do to also support the police in having to have standard rules will help them in making sure they identify those doing the wrong thing. So as much as it is a health issue, it is an operational issue. It's about making sure police have consistency when they're applying, when they're trying to work out who's doing the wrong thing. And also this will mean that there'll be less number of people in certain locations, because even in those local government areas not of concern throughout Greater Sydney, you'll be able to go within your local government area or only within 5 kilometres of your home instead of 10. So whilst there's no strong evidence of outdoor transmission, operationally, we've essentially said to the police, what do you need to do? What do you need to give you greater compliance? And that's one of the things on their list. And I just want to assure the community that not only will the Police Commissioner receive what he wants in terms of additional powers or additional resources, but more than what he needs and wants, to make sure we're not leaving any stone unturned and to make sure that the community is kept safe at all times.
It's been reported that you are looking at a plan for fully vaccinated people to perhaps have some freedoms next month. That may include going to bars, beer gardens, perhaps fully vaccinated people visiting other fully vaccinated people. Can you give people some hope about that?
As Dr. Chant and I said during the week, I've asked her to look at some categories of low risk and safe ways that vaccinated people can interact, but I don't want to raise expectations in terms of hospitality and things of the like. This will relate to other categories where there's low risk, but please know the key to our freedom is 70% double dose, which we estimate New South Wales will be at the end of October. And according to the Doherty report, which is our national cabinet endorsed plan, 80% of double doses will allow us to treat the COVID or the Delta variant more like the flu than what we are at the moment. But until we get 80% of double dose adult vaccination, which is what we've all signed up to, and on the current rates, and New South Wales is doing slightly better than what I tasked, I'm pleased about that. I'm pleased to know there's a high demand for vaccination, and there should be, because we know it's saving lives. And I've certainly let everybody in my life know, please go and get vaccinated, and I urge you to do the same. I don't want my loved ones feeling vulnerable, especially now. And for those who are concerned about their health and safety, please stay home. Know that you'll have every support in the world. If you need anything, let us know. And can I also please stress that in those local government areas of concern, we have non-government organisations working with government through Resilience New South Wales in particular, through Commissioner Shane Fitzsimmons, making sure that non-government organisations are working hand in glove with government, translations in over 150 different languages, dealing with community leaders one-on-one, dealing with people at places where they feel comfortable. We call it a micro-strategy in every single local government area of concern, and I want to thank police for their role in that. They've got their emergency management structures in place, working with social services and whole of government support to make sure that targeted approach is there. And we know the targeted approach is having positive impact. If you look at what's happened in Fairfield and Canterbury Bankstown areas, not that they're not areas of concern, we're still seeing cases in those areas of high numbers, but certainly the case numbers as a trend are declining. And that's what we need to see elsewhere. The front's moved through to Blacktown and Mount Druitt and Marylands and places like that. And unfortunately, we're seeing cases now in Western New South Wales, which are different in nature, but equally concerning.
Premier, given the support for vaccination, do you support a company like SPC making vaccination mandatory for its staff?
Oh, look, that's a decision for that company, and I applaud any company that's providing incentives for their workers to get vaccinated. Can I say the response we had to the way in which we approached construction, I remember being criticised. Just remind everybody how criticised I was when I shut down that industry, which had hundreds of workers on sites mingling with each other. And I just want to thank that industry now, because the way they've responded is a good model for us to look at in the future. They now have safe work practices, and everybody coming out of those areas of concern has to be vaccinated, and the demand has been extremely positive. The feedback's been positive. People want to get back to work in a safe way. And that has inspired people to come forward and get vaccinated, and I'm pleased about that. I'm really pleased that employers, business is really coming on board. They want to see their workers back. The workers want to be back at work, but we need to make sure it's done in a safe way. The last thing we want is to see these cases continue to increase, but they will if we don't get to those authorised workers, which is why the extra doses that we received brought forward. I mean, every state had some of its doses brought forward, including New South Wales. We're not getting any special treatment. Quite the contrary, we're getting treated the same as everybody else. But what we're doing is making sure we maximise those doses to where it's needed most. And it's those authorised workers that are having to go into other communities because of the jobs they do, whether it's aged care, whether it's disability care, whether it's freight and providing or working in supermarkets. Last Sunday we had a Super Sunday for all the supermarket workers. Tomorrow we have a Super Sunday for tradies and construction workers, and that's critical. We've already had, I understand, 10,000 people register tomorrow. I do want to stress there is a walk-in centre at Prairie Wood. If you're a construction or tradie who hasn't booked anywhere and you don't want to wait long, you can turn up to the Prairie Wood Centre and get a vaccination. So we're pulling out all stops because we know that vaccination is key, and I'm very confident we'll get to the 6 million jabs by the end of August. But I do want to foreshadow, as I've said, the most difficult thing for us as a team in New South Wales, for us as citizens of our state, will be living through September and October and keeping everybody safe until we hit those 70 and 80 doses. And I can't also stress enough that we need to reduce the case numbers. Opening up when the case numbers are so high is a risk, and we need to make sure we reduce those case numbers as much as we can. Our ultimate would be obviously not seeing anybody infectious in the community. but we also have to be real about the Delta strain. And what we've learned in the last few weeks is how virulent it is, but we also know that a shot of the vaccine and 2 shots of the vaccine is our best weapon for every single person in our state.
Of the Giant Steps outbreak, the outbreak at the Giant Steps School, has there been any more cases associated with that?
Yeah, I'll have to get back to you on that. I haven't been given any updates on what was said yesterday, but I'm happy to get you extra information. Who hasn't asked a question? Sorry. Yeah.
Premier, the permit system doesn't kick in for another week for the regional New South Wales exemptions. Will that allow people to continue travelling to the regions to their second home in that week? And why hasn't the technology with Service New South Wales been made ready for this?
Oh, look, the technology is there, but we need to make sure that in a pandemic, you put resources where they're needed the most. And police know that they can start booking people from tomorrow with those extra fines. But the permit system will just make the process more efficient. But police will be able to know from tomorrow whether people are doing the wrong thing or not, and you will be fined. But obviously the permit system will be more efficient. It will take police seconds to make sure someone is legal rather than a couple of minutes potentially. So the police have their powers from Monday morning when it kicks in, and even between now and then, to stop anybody doing the wrong thing. But the permit system will just mean it takes less time and is more efficient. But obviously police know, and Commissioner and I had this conversation this morning, that from Monday they'll be able to make sure that they put those extra fines on people doing the wrong thing. But from next Saturday, it will just be quicker for them to do that.
Is there any scope to allow 17-year-old tradies in those LGAs the same access to the vaccine as 17-year-old HSCs?
Oh, I'm really pleased to say that tomorrow there are significant numbers of tradies and apprentices who are between the ages of 16 and 18 getting the vaccine. So I want to stress that we did prioritise in terms of the type of vaccine, because if you're under 18, you're only allowed one particular type of vaccine. So we have actually targeted apprentices and also tradies and others who are under the age of 18 in those local government areas of concern to come forward and get the jab, but also obviously people older as well. Our critical age for people in those local government areas of concern is between 16 and 39. That is the age group, because of their work, who are the most mobile, and that is also the age where unfortunately they have contact with 2 other generations. We know that in some parts of Greater Sydney there are 3 generations living in the one household. So those authorised workers are exposed because they obviously have to leave the home for work. They live in an area where there's a lot of virus, and then unfortunately they come home potentially and give it to the rest of their household. But a vaccine will stop the spread to everybody in their household. It means only some of their household might get it if they have the virus, and of course it also protects them. But we are seeing, at least the last time I looked, in excess of 60% of COVID cases are in people under the age of 40. We know that it's affecting young people. The difference is, of course, the vaccination, and the vaccination is protecting people and it's helping reduce the spread.
So those 17-year-old tradies, they'll be given Pfizer, like
Yes.
the HSCs?
Yeah.
Premier, you've lent very heavily, obviously, on.
Sorry, Tom, I can't hear you.
You've lent very heavily on the health advice through this pandemic. You're now taking advice from police, admittedly without any evidence, health evidence of outdoor transmission. What's changed there? Has the health advice let you down?
Oh, can I stress that what the Police Commissioner and I, Minister Elliott, announced today has been in consultation with the health team. The health team has been consulted every step of the way, and please know that from the beginning, I said that phrase again, but from the beginning of the pandemic, we've made sure that we have had a whole of government response. Health, police, our social services, Service New South Wales, everybody has been working together. So every time we make an announcement on behalf of the government, please know that it's a whole of government response. And Health has been saying ad nauseum from day one, anything to reduce mobility helps. Indoor settings obviously are much higher risk than outdoor settings. So whenever the government makes an announcement, it's in consultation with all of our relevant authorities. But of course, when it comes to specific health decisions around vaccination strategy or around local government areas of concern, of course, that's primarily a health issue. When it's a compliance issue, it's primarily a police issue. But please know, every step we take is done with a whole of government perspective, a whole of government responsibility. And that's the way we approach this issue. And I appreciate the citizens of our state understand that. That's how New South Wales has been acting from day one. But I wish we were perfect in all of our decisions. We will never be. I wish we had one secret formula for dealing with Delta, but it doesn't exist. But what we do know is the vaccines, both of them, are holding up really well. People with double vaccinated are staying out of hospital, are reducing the spread, and we know that our micro strategy in those key local government areas is also having an impact. And when I say micro strategy, I mean going down to the communities within communities within communities. The one-on-one work we've done with leaders, hundreds of community leaders, and reaching out to their members, going to places of worship, community halls, expressing things in different languages, making sure that everybody has access to the resources, the support they need, but also the languages or the translations has been key to our role. But obviously in Western New South Wales, the needs are very different. We have very vulnerable Indigenous communities which we're supporting and making sure that we get vaccine available to them as soon as possible.
Given the delay, the current delays in test results, sometimes up to a week now, should the rollout of rapid antigen testing be stepped up, and should it already be in place more widely?
Yeah, New South Wales is the first state through the National Cabinet process that's been trialling rapid antigen testing. We know business is very keen to do that. New South Wales Health has also been reaching out to our suppliers. We do see that as part of our defence, part of our weaponry against the Delta strain that we're currently experiencing. So that is something we encourage and we're supporting. And we'll continue to do so. But we are concerned about the delays in testing because the upside is it's just incredible. I remember earlier on in the pandemic that we'd be excited if we had 8,000 tests a day. We're now getting 130,000 people on average come forward every day. Some days it's been high, 150,000. And that is great, but the consequence of that is processing all the tests. So we are seeing delays of a few days, which is why we have that $320 immediate payment now available. So if people are waiting at home, they have access to the disaster payment if they're obviously out of work, but if there's somebody who is working that's been asked to stay home because they're for various reasons waiting for their results, well then obviously they'll also be eligible for that $320 payment.
Territory counterparts have expressed concern about the current outbreak. How much pressure are they putting you under to go further? How much was that discussed at yesterday's National Cabinet meeting?
Oh, look, I think it's acknowledged that the situation in New South Wales is acute. But that's why Dr. Chant and I were very clear in our language a couple of weeks ago when we said this was a national health crisis. New South Wales is the largest state. Sydney is the gateway to Australia in terms of overseas returns, and we knew that the Delta strain would be extremely difficult to deal with. So the other state premiers clearly understand that, and other state premiers have had to deal with outbreaks in their own states. But it's important for us to know that the formula for dealing with the Delta strain is in large part the vaccination rates. And we know that the more people that are vaccinated, and we've seen this experience overseas, in countries that are familiar to us with 50 or 60% vaccination rates where they have much more freedom than we do, but they are seeing thousands and thousands of cases, but they're seeing less people in hospital because of the higher vaccination rates. And really in time, when we get to the 80% double doses, we will start to count the number of people in hospital as opposed to the number of cases. And I want to stress that point because really what is important for us during the pandemic is to save lives, save health, but also save livelihoods. And it's that balance you need to strike. New South Wales has always striven or strived to make that balance, get the balance right. And it's not a perfect science, and I'm never going to admit that. And I also want to make very clear that the buck stops with me. I'm the Premier, and I have to make announcements and decisions on behalf of the government. And we do that based on whole-of-government advice, whole-of-government consultation, and we are working our way through this pandemic, and we have to accept that this is the worst situation New South Wales has been in since day one. And it's also, regrettably because of that, the worst situation Australia's been in, because when your largest state is so heavily impacted, it has an impact on the national economy, on the health system, and that's why we've been so vigilant in trying to get as many jabs in arms as possible in as short a time period as possible. And I think we have to accept that for a long time, for nearly a year and a half, we were different to the rest of the world. And now we're not different from the rest of the world. The Delta strain is diabolical, and we have to accept and be real about that, to say that even when you throw everything at it and even in situations in other states where they throw everything at it, cases are still emerging, and that's apparent. This is a really diabolical strain. We have to be real with what works, and we also have to be hopeful, which is realistic. I'm a realist, and that is that when you get to those double doses and you see that reduction in hospitalisation, you can live more freely. You can do things that other people in other parts of the world are doing. And that's certainly what we're working towards and why we're racing and sprinting to get those vaccination rates up. And I mean this in a heartfelt way. The way the community has responded and the patience that they've lent us in coming forward and getting vaccinated has been outstanding. And sometimes we've let you down. Sometimes we've made you wait too long, or sometimes the booking system hasn't been as efficient as it should. But please know, where New South Wales is concerned, I've always fought to get as many vaccine doses as possible in our state. I've always fought to have a sense of urgency to our program. I remember setting up mass vaccination hubs, and other people were telling me, why are you doing this? But this is because we were seeing what was happening around the world. We wanted to make sure we had capacity to get the jabs in arms as soon as the doses became available. And of course, there is no perfect path forward. Are we going to make more mistakes? Of course we are. We're going to frustrate people? Of course we are. But it's a journey we take together. And I feel it every day, and I want to assure people of that. I feel what we're imposing on our citizens, and I feel the fear. Just like everybody else, we all have loved ones. We all have people whose businesses are on the brink, who are really wanting that support. So we're working day and night. And when I say day and night, please know that every member of my team in every agency is working their guts out to support the community during this time.
Just on the singles bubble, sorry, has there been any transmission associated with the singles bubble?
No, there hasn't been, not that we know of, but having said that, what the Police Commissioner and what Dr Chant and what the whole team always speaks about is, whether it's through health or through compliance, is always trying to be that step ahead. We can't predict where things will go, but we can certainly take precautionary measures, and that's why we are taking those precautionary measures.
This today based on transmission in Sydney?
Well, obviously, we have a major issue with the cases escalating, and anything which reduces mobility but also allows police to put their resources where they're needed also helps us. If we know that people have less mobility, they're travelling less distances, it means police can focus their efforts on those areas of concern and in those areas where we know people are trying to dodge the rules. So it's as much about managing resources and getting on top of compliance as it is about responding to the health. Because when you're in a pandemic, even though it's primarily a health issue, it affects every part of anyone's life. It affects every part of government resourcing and services. So when you are in a situation where everything is stretched, you need to make sure you're putting resources where they're needed. So sometimes our decisions will be totally focused on health and wellbeing. Other times they'll be focused on making sure we manage the resources as best we have with our police to make sure the extra 1,400 and highway patrol and everything else are put where they're needed the most. And anything we can do, and I know that means that people in areas where there are very low or no cases are making sacrifices as well. But we are in this together. And no decision from here on in, no decision from day one has been easy. But what we have to do is weigh up what is the best thing for the majority of our citizens. And we know that every decision we take hurts some people, makes some people happy, makes some people very angry. But at the end of the day, I have to let go of what the noise is and just make decisions that are in the best interest of our citizens every single day, knowing full well there'll always be people that say it was too much or not enough. But what we need to do is base it on the advice, base it on what works for the majority of our citizens.
You said you're very concerned about Mount Druitt. Does that area now deserve a mass vaccination hub?
Well, I understand from speaking to our health people that we have planned mass vaccination hubs or even mobile hubs where we're going out to the community all across those local government areas of concern. The health website is updated frequently, but please know that if there isn't one in your suburb, there's GPs, there's pharmacists, and there will be one a couple of suburbs away. So I think people will understand that we can't have a mass vaccination hub in every single suburb because it defeats the purpose. What the mass vaccination hubs do really well is get through thousands and thousands of people in a very short amount of time. The GPs obviously can take a bit longer through their in terms of dealing with each patient. Pharmacists can actually get through things quite quickly as well, but the purpose of a mass vaccination hub is to be able to get through thousands and thousands of jabs in a short amount of time. And yesterday we did over 106,000 jabs in New South Wales. Can I again thank the GPs? They've done a huge amount. The pharmacists have really sprung up like nothing. We're so deeply grateful. The Pharmacy Guild has done an outstanding job in stepping up. And of course, our own mass vaccination hubs, our own hospital sites, and also the mobile vax hubs that we have, the pop-ups that we have where we go to a particular community, a place of worship or a hall, let everybody in that community know, come and get vaccinated, and we're getting good responses. And again, I apologise if you've had to wait too long. I apologise if the booking system's been cumbersome, but we so appreciate the fact that people are getting jabs. If we get to that 60% by the end of August, and then the 70% and the 80% as quickly as we can, that is a positive for us in ways that we will all appreciate.
Commissioner Fuller, just on today's...
Premier, why aren't you announcing the deaths? Why have you spent a few days where you haven't actually announced the deaths? You've left that to the health officer. You're responsible for this outbreak and lockdown.
I'm not sure how often you've been listening to my messages, but I've been announcing the tragic deaths every single day. And I think I've repeated on a number of occasions that whilst for privacy reasons we only give the age group and the circumstances, that every death is a person who has loved ones who has died in tragic circumstances, and our heartfelt condolences to all of those loved ones and families. And we say to everybody in New South Wales, we want to see a reduction in the number of families suffering. We want to see a reduction in the number of deaths we have to announce. And for those reasons, we're asking people not to cut corners, not to go visit extended family members, to exhibit every measure of caution. You shouldn't be leaving the house unless you absolutely have to. We know there's a group of workers that have to leave those concerning areas in particular, and that's why we're making a priority to vaccinate them, to make sure that they don't unintentionally spread the virus, get the virus, and then take it home to their families. And this is why it's so critical for us to make sure we get the message. Unfortunately, we know that some in the community don't take this seriously enough. They don't think it's a serious illness. But as Dr. Chant, myself and the ministers have said every day, it is a horrible disease with horrible consequences. Infectious, the Delta strain has an infectiousness to it like we've never seen before. And we've seen similar populations to New South Wales around the world have thousands and thousands of cases reported every day. Now, we don't want to get to that in New South Wales. We want to make sure the case numbers come down and not up. And that's why we want to make sure that people not only understand how serious this is, understand the rules, but please follow them. Don't think it doesn't apply to you. You might think you're going to be okay, but think about your loved ones who may not be okay. And unfortunately, we see that in some circumstances, it has randomly caused death in younger people. And we know in New South Wales, 70% of cases are people under the age of 40. That's why we're focusing our vaccinations on 16 to 39-year-olds in the next few weeks, in particular in those areas of concern. But everybody who has access to a vaccine, doesn't matter where you live or what your age, you should come forward and just get vaccinated.
Premier, when can the people of New South Wales expect to see the numbers coming down?
Well, I wish I knew that, and I wish Dr. Chant knew that, but we will see the numbers come down when people stay home and people don't move about unless they absolutely have to. And until we see that, we're not going to see the case numbers go down. Unfortunately, it only takes, as we said, a handful of people to do the wrong thing. And every day, through Crime Stoppers or through direct involvement, the New South Wales Police Force has dozens of examples of people who are flagrantly just disobeying the rules. And you can't have that happen. You can't have that happen when there's such a serious disease.
The rhetoric for weeks has been about opening
Why
up.
do you think it's acceptable, and Deputy Premier as well, why do you think it's acceptable that regional New South Wales found out about the lockdown via social media and local media as well as metro media was not engaged to help spread this message, particularly to vulnerable communities who might not have social media?
Can I please make this point very clear? When we announced the various health updates at 11 o'clock on Saturday, we went immediately upstairs and Dr. Chant advised me that there are additional local government areas of concern. We consulted the Deputy Premier, of course, and our other colleagues, and it was apparent to us as a precaution there would have only been a handful of local government areas that weren't affected in regional New South Wales. And it's important for us to make sure we get the message out as quickly as possible. There were various channels where the communication was made through community leaders, and we have to appreciate that there are so many communities in regional New South Wales that rely on their local networks, their local leaders, their local information, their local health districts to get the message out, and all of those channels were used. I think it's apparent that everybody knows the serious situation we're in, and I think people also know that when we need to take immediate and decisive action, we will. It doesn't matter what time of the day it is. It doesn't matter what day it is.
When did Scott Morrison tell you to do a statewide lockdown? When did Scott Morrison advise you to do a state? Can you confirm it was on either Wednesday or Thursday?
We take advice from our health officials and we always act on that immediately.
Speaking of borders, if the police operation doesn't work, are you considering curfews or a ring of steel? If nothing has worked so far, if that doesn't work?
I'll ask the Police Commissioner to address this issue, but obviously all of those issues are considered and canvassed, and police have given us their advice on what we must do to reduce people doing the wrong thing. And can I say, it comes down to us. No matter what rules are in place, if people are choosing to ignore them, we will continue to be in serious trouble. Can I stress the case numbers are disturbingly high, and we are, as Dr. Chan said yesterday, at a fork in the road. Do we want these case numbers to come down, or are we going to live in fear and have case numbers continue to go up? Now that is up to all of us together, and as we say every day, we know that the vast majority of people are not only doing the right thing, but they're proactively protecting their loved ones by coming forward and getting vaccinated and encouraging their loved ones to get vaccinated, as well as staying home. And it's so hard. All of us know how hard it is to not see your loved ones and not do the things that we're used to doing. But I say to those small number of people, small proportion in the community, do not continue to break the rules, because it will continue to have tragic consequences. It will continue to cause distress. Having said that, we also know how important it is to vaccinate 16 to 39-year-olds who previously did not have access to vaccines. When I say previously, prior to this outbreak. It's so important for us to get to that demographic. 70% of cases in New South Wales are people aged between 16 to 39, and in particular in those local government areas of concern. And that is why we must ensure that we provide that opportunity. But I do want Commissioner Fuller to also address those policing issues, as he has considered them all in relation to police operations, and we need to let police do what they do best. But I will ask Commissioner Fuller to talk about those operational issues.
Borders, because we have effectively, or you have effectively said that, you know, COVID zero is we're going to have to learn to live with some cases in the community. The WA Premier is still saying he wants a COVID zero policy. No doubt there will be other premiers in Australia who want the same thing. How are we going to live going forward as a nation? Will New South Wales end up an island within an island?
If you even look at the Doherty report in relation to COVID, it says strong suppression, because I think we all accept there's never been a complete elimination strategy, because we know that so long as Delta or so long as COVID exists around the world, so long as we know Australians are coming back home, there will be cases, there will be outbreaks. So the question is, how do we live with it? I would love to have a situation where we had 0 cases of community transmission. I mean, of course we strive to get close to that as possible. And in fact, even since day one of this outbreak, we've said we want to get as close to having no infectious people in the community as possible. We've said we want to get as close to that number as possible. And that is exactly what we're striving for. Let me make that very clear. But can we pretend that there will always be 0 cases of Delta in Australia? I don't think that is a realistic proposition. What is realistic is trying to get the number of infectious people in the community as close down to 0 as possible. Now, that is always our intent. But we also have to accept we're not going to wipe this out. We're not going to have a situation where across Australia, whether it's in the quarantine system or elsewhere, that we're not going to have 0 cases.
So
I think, and can I just say, can I make this point?
James, what does that
No,
mean
excuse
for
me, can I finish? Can I make this point? What I've just said is no different to what we've said for weeks and weeks and weeks. It's no different from what we've said to the start of the pandemic. We have to, whilst COVID is active globally, and whilst the Delta strain is causing carnage all around the world, we can't pretend we will get to 0 and stay at 0 forever. Even when you follow the Doherty report to the nth degree, after you have 80% of double doses and you open up to an extent, depending on your case numbers, you open up, you're still at risk and you will see cases pop up. But obviously when you have 80% of your population vaccinated, that reduces the number of people that will end up in hospital and the number of people that will die. So let me make this very, very clear, which I've said from day one. It's always our aspiration, and we have to work hard to get these case numbers down. It is not a pleasant is the wrong word to use, but it's not a situation that rests comfortably with anybody. Quite the opposite. It's a horrible situation. We need to turn that around. But can I make this point? To suggest that we're going to have 0 the whole way through until the pandemic ends across the world is, I don't think, a realistic proposition. Even the Doherty report talks about strong suppression. Even when you get to 80%, it's about strong suppression. It's about reducing the numbers as close to 0 as possible in terms of people infectious in the community. That always has to be our aspiration. Now, we will have to work really, really hard to get to that. But we also have to be real. Delta is with us, and even when you get to 80% double doses, you have to manage it. You have to learn how to live with it without having major outbreaks. And our aim, as it has always been in the pandemic, is to keep people out of hospital, to keep people alive and safe, but to also make sure that we can live as freely as possible. And the chance we have to do that is with those higher vaccination rates. But also, can I say, we desperately need to reduce the case numbers. And we've been clear about that from day one. The comments I made yesterday weren't a big revelation. They're things we've been saying for months and months. And if other premiers, because at the end of the day, we know that we can't have society living the way we are now forever. So the way out of this is high vaccination rates and lower case numbers. And we've been saying that from day one. And our aspiration to have less, as close to 0 as possible in terms of infectious people in the community remains what we want to achieve. I want to make that very clear. But to suggest that we'll have 0 all the time across Australia with Delta is something people talk about, but we also have to be real. Whenever you're welcoming home Australians, the likely strain that they're going to have is Delta. So whether it's in the quarantine system or elsewhere, we're likely to see cases pop up. And even other states who are grappling with a handful of cases know how stubborn this thing is. Even states that have locked down are still getting a handful of cases, and it's really stubborn. But we need to get the number down. And we've been clear about this from day one, and people at home get it. We need to reduce case numbers, and we need to get those vaccination rates up to protect people and prevent them from going into hospital.
Premier, people don't understand what close to 0 as possible means. What is your target, a specific number for case numbers where the community can feel like the strategy that we're employing is working?
Well, obviously, there's no exact science to what close to 0 is, but it would depend on where is it occurring. Is it controlled? Is it linked back to the cases? And if you find the way all states and all nations report on their cases, in fact, in Australia, we're fortunate in that we're still in a position to be able to report on the cases we have in isolation versus those that aren't in isolation. But let me be clear that In other states where the virus is present, all state leaders are talking about the numbers infectious in the community, because we know that's what is concerning. When people are isolating and they get it, as tragic as it is, we know that at least they haven't infected other people during the course of their infectious period. And what worries us, and as we've said, our aspiration is always to get as close to that zero number as possible. But when we get to 70% double dose or 80% double dose, we'll take advice from Dr. Chant, depending on where the case numbers are at, as to what freedoms we have at those stages. And I want to be very clear about this. We can't afford to live the way we are forever. So we have to have a roadmap out. And our roadmap out is compliance, making sure people do the right thing and stick to the rules. And secondly, is to protect the community through higher rates of vaccination. We know that both those things work. Excuse me, can I just have everybody ask me one at a time?
Premier, will the isolation payments be extended out to the region?
Oh, well, certainly if we think there is a need to do that, of course we will. And we want to do every measure we can to support communities on the ground so that they are in a position to make sure that they're able to follow all the health orders to the letter of the law. And that means supporting communities, as we've done in various parts of Greater Sydney. Of course, we'll do that to the regions. And I just want to make this point, that when the Treasurer, the Deputy Premier and myself and the Crisis Cabinet were considering the financial support package, we didn't just include it to the areas of concern. Our financial support package extends to all of New South Wales, because no matter where you're living, if you're a business who's experiencing hardship, you can apply for our business grants. If you're an individual who's lost their job or had reduction in hours, you can go to the disaster payments. We've also got direct payments, of course, to people who might be at risk of not isolating when they should be, and of course we'll extend that to the regions. That's a no-brainer for us. We're throwing everything at making sure people have the support they need to get through this, but also they have the support they need to follow the rules. We can't afford to have even one or two people, imagine one or two people in a country town going about and not obeying the rules. That will then quickly get to 20 or 30 cases. So we know the risk, and that's why we're really stressing to everybody, don't be that one person that keeps the lockdown longer than it has to be. Don't be that one person that unintentionally causes distress to family and loved ones. Don't be that person.
Premier, is it your understanding of the Doherty report that where we are now, we can still live more freely with the virus when we get to 70% double dosed or 80% double dosed vaccination rates? Can we still live more freely after that point? Or, because case numbers are so high, do we need those case numbers to come down so that even if we get to 80% double dose, we won't be able to get out of the lockdown?
Even if you get to 80% double doses, if the case numbers are very high, it does limit what you can do.
Did you decide that because that has not been...
No, that is, if you read the Doherty report, the Doherty report is based on the premise of 30 to 40 cases in relation to all the things you can do. So let's not confuse the two issues. You can live life more freely than what you are today, but the extent of your freedom depends on the case numbers. If case numbers are where they are now and we get to 80% double doses, we won't be able to do everything that we want to do.
So the lockdown won't lift if we get to 80% double dose, if the case numbers do not come down even in November.
Yeah, can I just make this very clear? There is a difference between a lockdown and restrictions. We will need to live with restrictions so long as Delta is around. So long as Delta has presence in the world, even if we had 0 cases and we were at 80% double dose, you would still have to respect some rules that exist around vaccinations, around social distancing, around mask wearing. So long as Delta and deadly COVID is around, we will always need to live with a measure of restriction. But what we can do at every point is also determined by the case numbers. Will life be different when you have 80% double dose of your community vaccinated? It will be different, but the extent to which it will be different depends on the case numbers. If you have 500 cases a day at 80%, that is still dangerous just to say let it rip. You can't let it rip.
So Dr. Chant,
report today that Scott Morrison...
Since we let tradies go back to work.
I'm sorry?
It's been 2 weeks since we let tradies go back to work. To what extent is that contributing to the higher numbers? Have we seen transmission at building sites?
Well, I'll ask Dr. Chant to comment on that point, given she obviously gets the reports daily. But this is why we asked everybody from those concerning hotspots to make sure they get vaccinated before they get back to work. Because we know that there's critical work that needs to be done, but we also know that to protect the community, we need to make sure those jabs are in arms. But in relation to transmissibility, Dr. Chan's advice always is reduce mobility. Do not leave the house unless you absolutely have to. But of course, we know that even if you're vaccinated, but a large proportion of the community isn't vaccinated, you can still risk getting the vaccine, getting the virus and passing it on, but obviously to a lesser extent. But we need to understand the best way to reduce case numbers is to reduce our mobility. Only move around if you absolutely have to, and of course, set in the context of those vaccination rates. And the higher the vaccination rates, the more options we have, but the higher vaccination rates have to be done in tandem with reducing case numbers. Because imagine, even if you get to 80% double doses, it does give you more options, but it still means if your case numbers are too high, you can't live as freely as you would like. And that is why the two things are critical. We've always said lockdown and vaccination. We know vaccination helps reduce the spread. It helps bring case numbers down, but it also protects people. But lockdown obviously restricts movement. It restricts the virus spreading the rate it would have. We would have had thousands of cases today. I mean, Florida has a population of 21 million and they've got 150,000 cases a day. I'm sorry?
Gardeners and landscapers in the hotspot LGAs have been hearing they may be allowed to go back to work soon. Is that the case?
Well, obviously we call upon people to reduce their mobility, but any allowable work within those LGAs of concern would always be contactless. We can't have people in contact with one another. They are the concern. So obviously, government is speaking to stakeholders about what is a safe thing to do as we are working our way through the lockdown.
And just on business, Premier, just on business
last
payments,
question.
there are not-for-profits.
Last question.
You keep talking about, you know, we could have had 1,000 cases, but every week, seemingly, we're going up into the next 100. I mean, what's to say we're not going to be at 500 next week and then 600 the next? I mean, we could hit 1,000 cases.
Well, we absolutely could if people keep ignoring the rules. And it is a combination of things that will turn things around. The most important thing is for people to stay at home. Don't leave home unless you have to. It is very frustrating every day when we get examples of a handful of people doing the wrong thing, having parties or having gatherings they shouldn't be having, or leaving the house when they've got symptoms and they haven't been tested. It's horrible hearing those examples every day. They're not a lot of examples, but only 4 or 5 across the population causes enormous grief. So that's why the police operations have been substantially enhanced. We have 500 extra ADF on the ground from today. And secondly, is to prevent hospitalisation and death through those higher vaccination rates, and also to reduce the spread.
What took you so long?
Thank you, everybody.
Why was there a wake-up call yesterday, Premier? Why did you only wake up yesterday?
Premier, if, as you say, September and October is going to be our most difficult months, how can you also promise freedoms in that time? And can you be a bit more specific as to what exactly you're talking about? What are the freedoms you need?
I've been asked this question a few times, as is Dr. Chant, and we've tasked her to consider if people are completely vaccinated, what low-risk activity can we provide once we get to 6 million jabs during September and October? And she is considering her advice, and I want to make that very clear. So I have always set ourselves a target of getting to 6 million jabs by the end of August, and I'm so pleased that we're going to get there with a bit of room to spare as well, fingers crossed. But that will mean that we can consider opportunities for people who are fully vaccinated in September and October, and I'll be able to convey that as soon as we get closer to that August 28th day, and as soon as we know where things are at in terms of case numbers and areas of concern. And the challenge for us is we want to make sure those opportunities are made available to as many citizens as possible. So it does depend also on what is occurring in those areas of concern. And it's really important for us to keep the community updated as soon as we know anything. But at the same time, we need to allow our health experts the right opportunities, the right time to be able to provide us that advice. So.
really high case numbers, and September's only in 2 weeks.
Yeah, can I make it very clear that we are assuming that case numbers will go up. Now, I say that only as a realist, because when you have cumulative days of high case numbers, there is a tipping point where case numbers go up. But our challenge is to make sure that we keep vaccination rates up, because the more people that are vaccinated, the less likelihood of hospitalisation and the less likelihood of death. And we know the vaccines, either vaccine, have proven to be extremely useful and extremely protective against people ending up in hospital. But also, we know from the health experts that after the first dose, you get the first dose, 2 or 3 weeks after you get the first dose, you also see a reduction in how contagious you can be if you do get the virus. So we know it will have an impact on spread as well as keeping people protected. So given that we're now deploying at least 600,000 vaccines through a targeted approach in those areas of concern, that we will have in 2 or 3 weeks' time a much greater proportion of the population who are protected against spreading the virus further, but also protected against hospitalisation. And the key challenge for us is getting to as many of those hundreds of thousands of authorised workers as quickly as possible between the ages of 16 to 39, because we know that is the age group from those areas of concern that are going out and doing those essential jobs that all of us rely on, doing those essential jobs which keep food on the table and keep services that we need happening. And as soon as we can get all of them protected, the results will be indicated in terms of reducing the spread, but also reducing hospitalisation. So all of these factors are taken into account. But I do want to stress that once we get to 6 million, it does give us options as to what we can consider in the months of September and October. And obviously by the end of October, we will get to 70% of double doses, which gives us more options about what we can do. So whilst there will not be complete freedom at 70%, or even 80% depending on the case numbers, life will be much freer than what it is today. And that's the point I want to make. Because even countries around the world with 80% double dose vaccination still rely on QR codes, mask wearing in certain settings. So we know that whilst the Delta variant in particular is very active around the world, there'll always be a level of protection we need to have. But life will be much freer than what it is today, and that is the key point. That we won't have to live with the harsh restrictions that we're living with today. But that's why today and in the last few weeks we've done a call out not just to people in those areas of concern to get vaccinated, but especially our older citizens. If you're over 70 anywhere in the state, please do not hesitate to get the vaccine, because that will protect you into the future. So even if you're not worried about it today, when we're at 80% and the community is freer than what we are today, that does increase the risk for people who aren't vaccinated. People who aren't vaccinated will have a greater risk of ending up in hospital or dying. We don't want to see any of that happen. That's why in particular we're saying if you're over 70, and the vaccination rates have gone up substantially in those age groups, but if you're over 70 anywhere in the state, and the Deputy Premier made the same point for our regions, your region, your city may not have had a single case during the entire length of the pandemic, but please know down the track in the months ahead, when we get those higher rates of vaccination, we start opening up, people who aren't vaccinated will have a higher risk, and we don't want to see anybody who's vulnerable susceptible to any risk. We want to make sure that people are protected as much as possible.
If you're saying that the cases are going to go up in the current settings with the current restrictions over the next 2 weeks, that's what you said, you think that the case numbers will go up. How can you then take the foot off the brake, even for people who are vaccinated? We know that vaccines don't stop fully the spread. So you're saying case numbers are going to go up in the current settings, you're willing to see case numbers go up even further if you take the foot off the brake.
But we know even now, even during a strict lockdown, any community anywhere in the world, even during a strict lockdown, whether it's New South Wales or any other state, still allows citizens to do certain activity. In New South Wales, some of those activities...
The case numbers going up has massive ramifications for people.
Can you please let me finish my question?
Premier, the case numbers going up, if it reaches over 500, it has ramifications for people in the rest of the country. So are we willing to let that happen?
As I've said, and I'll say again, when you get to a point where a particular proportion of the community is vaccinated, there are considerations for fully vaccinated people to undertake low-risk activity, which other states around the world with similar situations to New South Wales, or far worse situations than New South Wales, are already doing. So we are looking at, I am not about to make any decision, or I should say the New South Wales government is not about to make any decision which is going to either impact our case numbers or else risk human life. That is not what the New South Wales government does. But is it our job to look at how we can allow the community to live as safe as possible and provide an extra freedom? Of course that's our job. I would never expect anybody to suggest that we should sit on our hands and just let people live the current way for the next couple of months. We always have to challenge ourselves. We have to make sure that they're educated decisions based on the health advice. But if there are low-risk activities which can be identified in September and October, we'll provide those opportunities. But having said that, please know we are putting our foot down in terms of reducing the case numbers. That is critical. But the reality is, given the number of cases we've seen in recent days, I would not be surprised if those case numbers continue. That is not the trajectory we want for New South Wales. But we also have to be real about what is likely to be around the corner. But we also have to know that vaccinations are a good way to keep us safe and out of hospital, and to make sure our loved ones are protected.
We have the toughest restrictions in Australia in Greater Sydney.
Oh, look, you have to look at all of the settings in total. But if you look at the length of our lockdown and the restrictions we have in place, it is a combination.
Masks outdoors, playgrounds closed.
It is a combination of things, and even during the harshest time of the Victorian lockdown last year, citizens were still able to do some things they can't do in New South Wales. So you have to look at the total package of lockdown and strict lockdown conditions. There are still things we can't do, and as we know, dealing with Delta through a short, sharp lockdown doesn't necessarily work either. So we have to be real about that. The Delta variant is like nothing we've seen, and we all have to be real about that. Sorry?
To ask you about regional permits. In Saturday's press conference, you said the technology was there for Service New South Wales to roll out the permit system to cover the regional areas. If that's the case, why are applications only opening at the end of the week when the permit system starts on Saturday, and how long will it take to process?
Yeah, no, we made very clear the day we announced those extra measures that the permit system would be, the actual permits would be issued from Saturday. But please know the police officers, police force can still book someone based on the information they have. The permit system simply makes it more efficient and takes less time for police officers to get to the bottom of a case. When police pull you over, or confront you, they will know when you're doing the wrong thing. But it will take them less time if there is a permit in someone's hand to be able to say that that person is travelling legally. And that comes into place from Saturday. But until that time, make no mistake, the police have the ability to fine you those substantial fines or worse. But obviously it may take them longer. But the permit system, which comes into effect from Saturday, gives them the opportunity to do it more efficiently and quickly.
Premier, the LGAs of concern, the dozen LGAs of concern, can you confirm there is going to be some adjustment there with the 5K rule, that people who are going shopping or exercising in those LGAs cannot go into the next LGA that they're bordering on?
Well, no. In those areas of local concern, there is a flat rule of a 5-kilometre radius from your house. So you're not supposed to go anywhere beyond that 5 kilometres.
Can you go into the next LGA?
Well, it depends. You might live right on the border, right? So if you live right on the border, that's why it's a simple rule in those local government areas of concern. You're not supposed to go anywhere outside of a 5-kilometre radius of your home, irrespective of the local government area, because obviously if you live right on the edge of the street to the boundary, that limits your opportunities to go perhaps to your closest shop might be 100 metres away, but in a different LGA. And that's why we've made that rule, to make it clear. If you're in an area of concern, you shouldn't be doing anything outside of, well, firstly, you shouldn't be leaving your house. But secondly, if you do need to leave your house for an essential purchase, you should do it within 5 kilometres. If you're doing exercise, it should be within 5 kilometres. And obviously, we only want you to leave home if you have to for work purposes or for vaccination.
On the thresholds, Premier, if we're easing restrictions when we get to 70 to 80%, how are you going to manage the risk to regional and rural New South Wales. Will that 70 to 80% threshold, will that be a statewide total that when Sydney gets to 70 to 80%, the whole state will start opening up, or will Sydney start opening up when regional and rural New South Wales will still be locked down because they will not be anywhere near 70 to 80% double dose?
Well, these are the challenges that the New South Wales government has to consider moving forward, and that's why we're encouraging firstly people in areas of concern to make sure they take the opportunity to get vaccinated. And as the Deputy Premier said today, we don't want to see any rural and regional communities who may not have felt the need to get vaccinated until this point in time have lower rates of vaccination than the rest of the state. So ideally you want those high levels of vaccination to be equal across all the state, but we're confident we can get there.
So
we're
Premier,
confident that the people of the state will come forward to get vaccinated, but we don't want to see any community left behind. And ideally, given the concentrated effort in those targeted areas of concern, we'd love to see those vaccination rates go even higher than 80%. So it's really important for us to not only target the areas of concern, but also to make sure that there isn't any part of our state which has lower rates of vaccination than the average, because that will ensure safety. It will also ensure that particularly vulnerable communities will be protected once we get to a stage where people have greater freedom.
So,
because
Premier,
once you start opening up, when you get to the 70% or the 80% double dose, people who are unvaccinated will be exposed, and we don't want to see anybody unnecessarily go to hospital or worse. So we are really working towards getting increasing rates of vaccination as quickly as we can across the entire state, and increasing the availability, the points of access for people to come forward.
Specifically, Premier, will Sydney need to wait until regional and rural New South Wales get to 70 to 80% double dosed, or will the whole state start opening up when the whole state's population gets to 70 to 80% double dosed, even considering the fact that that will mean some remote communities aren't vaccinated at all?
Well, these are the difficult public policy decisions our government will need to take as we get closer to those targets. But that's why we have, and can I again thank Susan Pearce and her team, we don't do it enough, but they are working around the clock to get jabs in arms across the length and breadth of our state. And points of access, as the Deputy Premier would know, points of access in rural and regional communities are sometimes more challenging because your GP may live a considerable distance away from your home, your closest health site might be further from home, but we're making sure as much as possible that people have access to the vaccine, that they can confidently take it, and make sure that we get those rates up in every part of our state. And there is now the ability to look at the vaccination rates by postcode through the New South Wales Health website and through Service New South Wales. So now you'll be able to look up your postcode to see how the rates of vaccination are in your community. But obviously, we will be safer if we have those high rates of vaccination universal across the state. We know that's not the case yet. And just to give you an example, in some parts of Western and Southwestern Sydney, we only had vaccination rates of first dose at around 19%. In some of those same communities, first dose vaccinations are now in their late 40s. So in the last 3 weeks, there has been an incredible jump, and I'm so heartened by that, because it means there's an extra layer of protection, but also we can see, or start to see, not yet, but in 2 or 3 weeks' time, a further reduction in the spread once those jabs take effect. It does take time.
Can I just ask again about schools? Is it realistic that they will go back this term? It seems not. And if that's the case, can you tell people now, and perhaps give us an idea of when you'll be able to outline a roadmap? I realise it's really hard because they're not vaccinated.
Yeah, we are still working on the roadmap to schools and what education looks like in fourth term and third term. But that is why we're planning ahead in vaccinating, obviously as a starting point in the areas of concern, all the HSC students. We made that decision knowing that we want HSC students to be able to sit for their examinations, which is a requirement for them to attain the HSC. So we're very keen to make sure, firstly in the areas of concern, and more broadly that everybody feels safe when they're sitting for their HSC exams. And we're also looking at opportunities obviously in September and October for vaccinations amongst broader numbers of students who are eligible to take the vaccine. So that is a strategy in hand. Health and Education and other government agencies are working very closely as to what school can look like and might look like. And we know that parents want certainty, as do I. One of the things that causes causes me the most stress, and I have to say this honestly, one of the things that causes me most stress is the stress that I know households go through when they're homeschooling, and we want to provide that certainty. But we also know parents are stressed about the safety of their children. Unfortunately, Delta is impacting young people unlike other strains. Young people aren't spreading it, not necessarily getting it in high numbers, but obviously we want to make sure that children are protected, and that is why we have to have a school safety plan that addresses those concerns, but also the health needs of younger people during what is a particularly nasty strain of the virus.
$87 million in business grants, Premier. In business grants, Premier.
Blow yesterday for many people to hear that 80% vaccination is probably not the ticket to freedom. Can you give them anything to cling to today about what much freer means? In November, will we be sitting at restaurants? Will we be seeing our family?
I was a bit more concerned, about some of the commentary around the comments yesterday. 80% double dose means we can be freer than what we are today, no doubt about it. But does it mean we forget QR codes? Absolutely not. Does it mean particular events will require double dose vaccination? No. So we are working on a plan now as to what life will look like at 80%, and it does depend on the case numbers at the time as well. It doesn't mean that we'll be living the way we are now. We'll be living life a bit freer, but the level of freedom will depend on the case numbers at the time. In some countries, which is not the strategy of the National Cabinet or the New South Wales Government, in some countries, once they get to a particular rate of vaccination, they don't care. They just say you have complete freedom, don't check in, don't do anything else, and then they see thousands of people with the virus. We're not about that. We're about making sure that when we hit those vaccination targets, we're considering the safety of our citizens, we're considering what restrictions still need to be in place to protect people who aren't vaccinated. But will life be much freer at 80% double dose than what it is today? Absolutely. But we don't know exactly what that looks like until we're closer to that time. And at the moment, we get to 70% double dose at the end of October, we get to 80% double dose in mid-November. But the extent of what we can do is dependent on rates of vaccination, obviously, but also where the case numbers are at. And ideally, we need to see them much lower than where they are now if we want to live life freely prior to the outbreak.
Deputy Commissioner.
Last question.
There's
Sorry.
$687 million in business grants, Premier.
I'm sorry?
$687 million in business grants that still haven't been paid. Will that $687 million be paid to businesses who have applied by the end of the week? Will that be cleared?
Yeah, I'm pleased to say that the wait times are now down to 10 minutes on average for businesses applying.
That's just for the call centre when people call to ask where their money is.
Yeah, please. I was about to get to that. So obviously we're pleased that the wait times have reduced, and on average, businesses are receiving the money in their bank accounts within 4 or 5 days of making their application. So we again apologise for any frustrations or delays that were experienced. I understand there's nearly $1 billion that's gone out the door in terms of business support, but also please know that irrespective of where you live in your circumstances, that there is help and support for you as an individual through disaster payments through Service Australia, and of course through Service New South Wales for business grants. So we've reduced the wait time substantially. The last report I had told me the average wait time was 10 minutes, but also in relation to getting the money in your bank account, the average day is 4 to 5 days after application.
So $700.
Deputy Commissioner. Could I ask about vaccine incentives really fast? Could I ask very quickly about
last question for me, and then Deputy Commissioner, and then that's it. Sorry.
You had mentioned that.
I'm sorry.
You had mentioned that that you were looking at vaccine incentives, like things like the Die and Discover. Where is that at?
Yeah, that's why I'm urging everybody to get vaccinated. If you want to get back to work, and if you would like to attain a service that you currently don't get to do, we're encouraging everybody to get vaccinated, because full vaccination will give us opportunities to provide individuals during September and October. That is what we're considering, and that will depend on the health advice. But having said that, I just don't want anyone to be under any illusion that we desperately need to get those case numbers down. So yes, there are opportunities for greater opportunities for freedoms once we hit our vaccination targets, but they will be limited if case numbers are to remain too high. We need to get the case numbers down as much as possible to allow us to consider greater options and opportunities. And I think people understand that. It's obviously the higher rates of vaccination and the lower the case numbers, the more opportunities we have to give people safe options. And that's what I want people to consider in the next few weeks. Deputy Commissioner will answer the final question, and then we'll be back here tomorrow at 11 o'clock.
Deputy Commissioner, just very quickly on...
That should be isolating, that should be in their home, that they remain good to that and they do not put the community at risk. Thank you.
Premier, what's it going to take here? Is it going to take 1,000 cases a day, 1,200 cases a day, before you institute a proper stage 4 lockdown? This lockdown is not as hard as in New Zealand, as in Melbourne. It's clear there's this gap before the vaccination. How many cases a day is it going to take?
Look, we rely on the advice of our health experts. We know that our lockdown is extremely harsh and extremely strict. And we appreciate the pressure that so many families are on because of the lockdown. The vast majority of people are doing the right thing. But what concerns us... Can you just let me finish the answer, please? But what concerns us is, as Deputy Commissioner Warboys just reported, police found at least 400 examples in one day of people leaving their home when they shouldn't be. In one day alone, police found 400. And what worries us is for every person we find doing the wrong thing, there could be somebody else doing the wrong thing.
There's 8 million people in this state. Of course 400 people are going to be doing the wrong thing. You have to have the right health orders and the right lockdown in place.
We have had and continue to have the right settings in place, but unfortunately too many people continue to do the wrong thing.
So the settings are right, aren't they?
Excuse me, it's not your press conference. There's a lot of other journalists here as well. Can I just say this point? That we know the settings we have in place are some of the harshest that Australia has ever seen.
Not the harshest.
However, we also know that unfortunately it only takes a small number of people to do the wrong thing to cause this amount of spread. That's why I'm urging everybody, stay home. Don't leave home unless you absolutely have to. And I'm also saying to people, we know that there is the light at the end of the tunnel. We know we'll get through this, but it will take us much longer than we need to if people keep doing the wrong thing. Now, I'm really, really pleased that we have so many people coming forward to getting vaccinated. So many tests are happening every day. I mean, yesterday we had more than 106,000 people get vaccinated in New South Wales. That is fantastic. We had more than 105,000 people come forward and get tested. That is fantastic. But we also had too many people doing the wrong thing. And having said that, I know how frustrating this is for the millions and millions of people doing the right thing every day across the state. And I share that frustration. All of us are making huge sacrifices when we think about the loved ones we're not seeing, kids aren't at school. I mean, this is a horrible situation, and it will take us longer if people continue to do the wrong thing. That's why we're grateful at Operation Stay Home. The New South Wales Police have already not only started their operations, but already identified hundreds and hundreds of people in a couple of days alone doing the wrong thing. Imagine if even if out of those hundreds and hundreds of people doing the wrong thing, a couple have the virus and are going around the community spreading it. That sets all of us back. So I can't stress enough, you can have every single rule out there in place, but when people blatantly do the wrong thing, it causes grief for all of us.
Why is Victoria 20 a day and your numbers are going up?
Premier, given the numbers that they are going up, the death toll is rising, is it now time for you to stop promising that some restrictions will ease next month?
Well, no, I think that the challenge for us is to make sure that whilst we're asking people to adhere to the strict rules, that we're also asking them to come forward and get vaccinated. The higher the vaccination rate gives us opportunities to think about what we can do to support people that are completely vaccinated during the difficult months of September and October. But what is most important now is just turning the corner. And as I said at the beginning of this press conference, at the moment, there's a technical term called the R factor or the R rating. At the moment, the R effective or the reproductive rate means that every person who has the virus is spreading it at the moment to about 1.3 people. We need that number to be below 1. we need to make sure that whoever has the virus doesn't spread it to anybody else. That's what will turn the corner. And until we hit that corner, we're going to see case numbers rise. And the way we stop case numbers rising is stopping mobility. Stop leaving your home unless you absolutely have to. Everyone is clear on the rules, and all the suggestions that people throw at governments of any persuasion have little impact apart from the margins. The main impact is people reducing their mobility. Don't move around unless you have to. Don't leave your house unless you have to.
Premier, the numbers aren't going up in Melbourne. They're not. They're 20 a day, every day, Premier.
Well, given that, are you now considering any further restrictions? Are you right now considering anything else that you might bring in the next couple of days, or is it essentially up to us to do the right thing?
Well, it's up to every citizen to do the right thing, but it's also part of the police compliance measures, the Operation Stay at Home, which has really ramped up. Commissioner Fuller and the New South Wales Police Force have put in measures across the state to clamp down on those people doing the wrong thing, the minority of people doing the wrong thing. And you can have the strictest rules in place, Delta leaves no room for error. Delta leaves no room for anybody doing the wrong thing.
And even aren't going up in Melbourne.
And even in other jurisdictions which assumed a short, sharp lockdown would get rid of their handful of cases, have found how stubborn the Delta variant is.
They're not going up there, are they, Premier?
We're getting reports. We're getting reports that there remains confusion about the 5-kilometre distance people can be travelling. So, for instance, in LGAs that are really large, like Wollongong, which is 48 kilometres top to bottom, there are people living there that are still travelling 15 to 30 k's to go for a bushwalk or go for a bike ride. Residents are really concerned. There's a number of different shopping centres as well that people can go to. So, can you please just clarify, how far can people actually travel for exercise and for going shopping, even if they have a big electric?
Okay, in the areas of concern, you cannot move more than 5 kilometres from your house. So in those local government areas of concern, 5 kilometres, full stop. However, as the Deputy Premier would attest, in many regional communities, your nearest shop might be quite a distance away, and that's why within the local government area is allowable. But can I just be straight about this? If you live anywhere in the state, you should not be going beyond 5 kilometres unless you absolutely have to. That is the bottom line. That is the bottom line. And you shouldn't be leaving your house unless you absolutely have to. But we also have to get the right balance in terms of knowing that in some parts of the state, in some parts of our communities, people need to go further to get essential things. But in those areas of concern, no more than 5 k's, full stop. No more, but even then, you shouldn't be leaving your house, and that's very clear.
On the areas of concern, Stuart Ayres and the Commissioner publicly said yesterday there would be a change to that rule, that the 5k rule would not apply for people who want to leave that LGO on the border. And you said yesterday, no, that's not correct. Does that mean Mr Fuller has been overruled on that?
Not at all. Can I say that the police have always we've made sure the police always have the powers they need to do the job they want. The Police Commissioner knows that. Without exaggerating, the Police Commissioner and I are probably in touch 10 times a day, as I am with Dr Chand and the Minister for Health and the health people. We are in regular contact about what we need to do in order to see a turnaround. But it is a collective responsibility. It's not government or business or community or individuals. It's all of us working together. It's all of us working together.
But sorry, Premier, do you think that there's an issue maybe with the public health order? I'm not sure. Is there? If people are still technically allowed to travel, further than 5 kilometres to go to another shopping centre in an area as large as Wollongong?
I think people understand what the rules are. Every time you leave the house, you have to assume you have the virus or somebody else has the virus. Every time you leave the house, you're risking your health and the health of others. We can't stress enough. Minimise your activity, minimise your mobility. Don't go beyond 5 kilometres. Now, these are the basic rules in place. And there are always exemptions. And that's because if you don't put those things in place, communities not only suffer, but then health department would be flooded with thousands and thousands and thousands of exemptions every day. So please know, people know the basic rules, and we ask everybody to stick to those basic rules and know that it's a collective responsibility. And I know I give the same message every day. I know I give the same message every day because some people aren't hearing the same message. Stay at home. Don't break the rules. Everybody knows what they mean. A small number of people are choosing to ignore what the rules are. And as Deputy Commissioner Warboy said, in one day alone, more than 400 people that police know of across the state, 400, left their house for the wrong reason.
Dr. Chan, question for Dr. Chan.
I'll get Dr. Chan a second.
In terms of the LGA, is it correct to say that it's not just the geography of the LGA, it's the population within it? So you can have a smaller population in a smaller area in a Sydney LGA that has, for instance, 100,000 people. If the Wollongong LGA has 100,000 people, it's still contained within that same number. Is that not the rationale behind the LGA movements?
Look, the rules are in place to keep everybody safe, and we just ask people, the vast majority of people know what the rules are, the vast majority of people know what the risks are. And it's important for us not to get caught up in the weeds of an issue. What is really important for us is for people just to do the right thing. Please do the right thing. Stay at home. And when you are leaving your home because you have to, only do so assuming that you've got the disease or someone you're coming into contact with has the disease. But every day that our vaccination rates go up, that is an important weapon in dealing with this outbreak. But the most important weapon in dealing with this outbreak is for everybody to do the right thing. And we don't give you every example of when people are doing the wrong thing. But in some communities, when there are illegal gatherings, when people flagrantly disrespect the rules, it is heartbreaking. It causes us heartbreak every day, to see examples of a number of people coming together, knowing they're doing the wrong thing and not caring they're doing the wrong thing. Can I just ask everybody to care? Don't care about us or the broader community, but care about those closest to you. Care about your family, your friends, that you could be causing inordinate amounts of grief. And I just ask everybody to care about their loved ones, even if they don't care about the rest of us, even if they don't care about those people they don't know. Care about those closest to you, because you are risking their lives and you're risking their livelihoods. But as far as the vast majority of citizens, please know I get that the vast majority want to do the right thing and are doing the right thing. And we are all sitting at home or really, really concerned that a number of people are choosing to continue to disregard the rules. But I am someone who always knows that at the end of this difficult time, there'll be a time again when we live freely, but that will take longer if people continue to do the wrong thing. And that's why police and ADF have more people on the ground than ever before to clamp down on people doing the wrong thing. And we don't apologise for having that strong presence. We don't apologise for doing that going the next level, because the future of our freedom relies on it. Our ability to get out of this quickly relies on it.
Dr. Chan, please.